Welcome to the Rhode Island Division of Developmental Disabilities DD Community Forum. Tuesday, September 16th, 2025. Hosted by Advocates in Action RI.
Welcome to our quarterly Division of Developmental Disabilities Community Forum. My name is Kelly Donovan, and I am from Advocates in Action, Rhode Island, and I am going to give it away to Heather Mincy of BHDDH.
Thank you, Kelly. That was a great introduction. Thank you all for coming today. We have a bunch of information to share with you. We'll go through our PowerPoint, and then we will answer questions. And I think that's all I have for now. I'm going to pass it on to Andrew.
Good afternoon. As soon as Deb gets the slides up, I'll go into them. Welcome to the Developmental Disabilities Community Forum, December 16th, 2025. As presented by the Division of Developmental Disabilities, RIPEN, Advocates in Action, and the Sherlock Center. Here are some Zoom tips to get us started. Tip number 1, stay on mute. Unmute only to ask questions. The icon of the microphone with the line through it is basically what indicates you're muted. Click that icon to mute or unmute. Tip number 2, it's your choice to turn your video on or off. It may help Wi-Fi to keep your video off. That's the icon with of the camera with the line through it. Depending on what you're using, that icon will help you turn your camera on and off. Just click it to do that. Tip number 3, not everyone can read the chat, so please try not to use the chat. And finally, tip number 4, click the interpretation button to see the ASL interpreter. If you're using a laptop, the globe icon is where that can be found. Otherwise, tablet and smartphone users can click More and click or select More to find this option.
Does anybody need help with the ASL button? If you do, raise your hand or put it in the chat and I'll help you.
Today's forums will share updates from Advocates in Action, RIPEN Self-Directed Support Program, the Sherlock Center, and the Division of Developmental Disabilities. So now for some updates from Advocates in Action. The 2026 Leadership Series. There are 2 images on this slide. Image number 1 is the Advocates in Action logo, which is a stick figure surrounded by a circle of stars standing over a map of Rhode Island. Second image, it shows a flock of geese flying over the Leadership Series class of 2026. Applications are now available for next year's Leadership Series class. The Leadership Series is an in-depth learning experience that's user-friendly, interactive, informative, and fun. We created the series with a team of self-advocates and other allies to empower Rhode Islanders age 18 and older who have an intellectual/developmental disability, I/DD for short, to speak up for themselves, navigate the DD system, connect with the community, and live their life on their own terms, just like everyone else does. Well, the series is designed primarily for individuals who have an intellectual/developmental disability. Family members, staff, and friends who will be supporting a class member are also welcome to apply. The Leadership Series meets weekly over Zoom from 1 p.m. to 2:30 p.m. Wednesdays from February 5th, 2026 to June 24th, 2026. The image on this slide shows a previous Leadership Series class meeting on Zoom with the words, "Let's Zoom." Most of the leadership series takes place over Zoom, with a few in-person events during our time together. Classes will meet on Wednesday afternoons from 1 p.m. to 2:30 p.m., beginning on February 5th and running through June 24th, 2026. The image on this slide shows the following 3 eligibility requirements people must meet to join the leadership series. First, you have to have an intellectual/developmental disability, and I should say have an intellectual and/or developmental disability. Requirement number 2, it says that you must be 18 years or older or be celebrating your 18th birthday sometime in 2026. And requirement number 3 is that you must be a resident of the state of Rhode Island. You don't need to be receiving services from the Division of Developmental Disabilities to join the leadership series, but you should be aware that we spend a significant amount of time talking about the DD system and related topics as part of the curriculum. Find out more. There are 2 images on this slide. Image 1 shows a picture of our leadership series informational flyer with a QR code. Image 2 shows information about how to register for our virtual leadership series open house, also with a QR code. Find out more. The term QR code stands for quick response. If you have a smartphone or tablet, you can scan this code with your camera and use it to open a link about the topics you see. You can find out more about the leadership series by downloading an informational flyer from our website and by attending our next virtual open house. To download the flyer, use the QR code to visit https://tinyurl.com/about S 2026. To join us at the open house on Wednesday, January 7th, from 1 p.m. to 2 p.m., use the QR code to register at www.tinyurl.com/L S 260 H -0126. Remember, hey, on the screen shows the word remember and 2 cartoon hands with a piece of string on the index fingers. Remember, the index application deadline for our next class is Friday, January 16th, 2026. To find out more about the process and complete an application, use the QR code on this slide to visit our website at www.advocatesinaction.org/leaders26_apply. The image on this slide shows a picture with the words "Let's Connect" and a set of icons about different ways to connect with Advocates in Action, which include by telephone, email, snail mail, our website, Facebook, and YouTube. Join our mailing list. When something is happening or we have news to share, we send out an email to everyone on our email list. You can sign up for the list by using the QR code to visit our website at www.advocatesinaction.org/contact. Thank you. And now to pass it on to the Sherlock Center.
I think, aren't we supposed to take questions after each section? I thought we said we were going to do that.
Yeah, we can.
Yeah.
Yep.
Any questions?
I thought that's what we were going to do.
The class is free. We've been doing it a long time. If you don't know how to use Zoom, don't worry. Neither do we. No. we have peer mentors who will meet with you and show you, and we have lots of tutorials, and people that have taken the class didn't have a clue at the beginning, and now they're better than a lot of us. So I mean, very good. So that's not a problem.
Andrew, did you want to say something about that? Oh, okay.
No.
Raise your hand. All right.
I was just trying to find myself, that's all.
I don't
He
think
meant on the screen, I think.
Yeah.
Any other questions about that? We'll put the slides back up. Here they come.
I don't think I have any questions because I know I went through the leadership series.
Yeah, you already
Right.
graduated, so you're good.
That's a good
Yeah.
good comment though, Anna, because
Yeah.
we've had some people apply even though they already took it, and it's for people that have never taken it. If you already took it, we have a graduate academy you can sign up for. If you graduated from the leadership series, you automatically can join the academy. You just have to fill in an application once. We also have an advocates graduate connections, academy connections.
Academy
What's it called?
connections. Yep.
Academy. I knew I'd get it right, and that's with all the graduates that want to join, and that's just once a month.
All right. And now to pass things off to the Sherlock Center, who will discuss the Rhode Island statewide workforce initiative.
Good afternoon. Hi, my name is Kim Einloth. Some of you may know me as the State Director for Living Innovations, a shared living provider. But today I'm with you as a workforce development consultant with the Sherlock Center, where I've been involved in the Rhode Island statewide workforce initiative for about 5 years. As a reminder, the Rhode Island statewide workforce initiative, which I'll refer to as RISWI, has one main goal, and that goal is to make it easier for employers, including people who use self-directed supports, to find and keep great direct support professionals. As most of us know, DSPs provide quality supports for adults with intellectual and/or developmental disabilities. RISWI was created to help improve support for Rhode Islanders with IDD by addressing DSP work shortages and DSPs not always having access to the training they need to do their jobs well. RISWI has several work groups to help with this work, including policy guidance and worker voice, marketing and recruitment, selection and retention, training and professional development, and data and reporting. Today, I'll share a couple of brief updates on the progress we've made over the past few months. Last time we met, I had referred to the self-direction staffing pilot, and we're excited to present to you shortly a summary report describing the pilot. What I can share with you today is that 81 people who use self-directed supports responded to a survey about their DSPs, and 3 people who use self-directed supports participated in a learning series focused on finding, choosing, and keeping great staff. Thank you to everyone who participated, and that summary will be posted on riswi.org and emailed by the Sherlock Center. This next slide talks about joining us. It's an invitation to join us for the 2026 annual RISWI Summit. It will take place on Wednesday, January 14th, 2026, from 10 a.m. to 4 p.m. at Rhode Island College. The Sherlock Center will email invitations this week. And it's notable that self-advocates and DSPs are most welcome. The schedule includes a morning that will be presented both on Zoom, or you'll have the option to attend through Zoom or in person at Rhode Island College. And you'll have the opportunity to share your thoughts about how to hire, train, and keep great DSPs. We will have a panel in the morning that will consist of people who went through the learning series and/or discovery, trying new ways to hire, train, and keep DSPs, and direct support is improving. Then we'll have a progress report, and last we'll have community feedback and provide priority setting. So that will be our morning. There will be an in-person lunch provided and an overview of work groups for anybody who wants to learn more about them. In the afternoon, it is an in-person only session where the work groups will come together and discuss the priorities from the morning that were identified from the morning, and we'll map out the activities for 2026. If anybody has any questions, or if you don't receive an email, you'll be able to email riswi@umn.edu if you're interested in joining us, or if you have any questions about anything that I just reviewed about the initiative and or the summit. Lastly, I'll share that if you want to participate in this initiative, please email us at riswi@ric.edu or visit the Sherlock Center's Direct Support Workforce webpage, which is riswi.org, and it contains resources to hire, train, and keep great DSPs. On your screen, you'll see an image of the Direct Support Workforce webpage and a QR code that will bring you directly to that webpage. And I think that's all for my slides. Happy to take any questions or comments.
I got one good question about this summit thing.
Sure, Anna.
On January 14th, could that be something for me and my co-workers as peer advisors to attend to?
Absolutely. You would be most welcome, and your colleagues would be welcome. We would love to have you there and share your thoughts about how we can improve the direct support workforce and what your experiences have been. You're welcome to share them. So absolutely, you'll be most welcome, Anna.
Thank you.
Well, I have a comment. I'm going to say this. You can count me in to join that meeting, Kim. I'm
Great,
open-minded
Christian.
for this one.
Excellent. Thank you, Christian. We'll make sure that you receive an invitation, and if you don't, you'll be able to email us at those addresses, and we'll make sure that you get all the details.
Excellent. And I'll let my counselor know. So this way, when I make the next appointment, he won't put me on for the 14th.
Perfect. Sounds like a plan. Thank you, Christian.
Just doing my job.
Yeah.
Any other questions? Yes. Sorry, Anna.
Sorry. I don't always want to be the one always talking on this thing.
I'm grateful for it.
Yeah, you're welcome. I know that could be a devastating. I know it'd be a yes for me on going, but I need to talk to my team first before saying yes to it officially.
No worries, Anna. You will be most welcome. Talk to whomever you need to talk to. And I think you know how to reach me. When we move to the next presenter, I'm happy to make sure that my contact information is available. All right. Well, thank you all very much. Handing it over to Ripon. I think I'm handing it over to Sue.
Thanks, Kim. Hi, everyone. My name is Sue Donovan, and I'm at Ripon. Few things that we have coming up. Really excited about the second annual Self-Directed Support Conference. It will be on March 20th, which is a Friday in 2026. It will start at 10 a.m. in the morning and finish up at 2 p.m. in the afternoon. The location this time around will be at the Doubletree by Hilton Hotel, which is on Post Road in Warwick, across the street from the airport. Registration will go live on the Ripon website on January 2nd, so stay tuned. There is a link on this presentation that is accessible if you are an agency that would like to attend and you would like to reserve a vendor table. And there's information on a registration page for vendors with a suggested donation. Next slide. In order to make sure that we have everything there that you hope and dream for, please take our survey for the second annual self-directed conference and tell us, there are just a few questions in the survey. There's a QR code here on the slide, as well as a link to the survey asking who you'd like to see at the conference, what topics would you like to hear about, what things would you like to learn more about, and even, what type of involvement you'd like for yourself or your staff. So please check out the survey. It'll be open for another, about another 2 weeks before we close that down. So please take a moment after today's meeting to tell us what you're looking for. Tell us what you'd like to find at the conference. We've got 2026 rolling in very soon, and we've got quite the lineup. Some great trainings and events at Ripon. In January on the 13th, we'll have Crystal Cerullo come from Sherlock Center and share a little community information session with us about their new online platform that they're using to connect and communicate with folks. It's called the Mighty Network. I just signed up myself. So we're really looking forward to that. That'll be a quick short meeting from 6 to 6:30 on January 13th. Then at the end of January, on the 27th, we have guests coming to speak with us about the Rhode Island SIBS group, which SIBS as in short for siblings, and our friend Amy Stone will be joining us to tell us about that group and how our brothers and sisters can get involved in that group. Again, that will be a short little information session on the 27th from 6 to 6:30 p.m. on Zoom. And then in February, we'll have our annual self-direction connection, and that will be in person. And we're going to do hybrid. So in person at Ripon, 300 Jefferson Boulevard on Saturday, February 21st. Come join us from 10 a.m. to 11:30 a.m. for coffee and donuts and juice. We'll be able to get together and network and share ideas. So we look forward to that. While we're meeting in person at Ripon, we'll also have someone online in a Zoom room with folks that couldn't make it in that day. In March, we'll enjoy the conference on the 20th. Hope that you can all make it. And then in April, getting ready for those summer months. If you want to do some traveling, we've got Journey with Jennings coming to talk to us about how to plan and put together some unforgettable memories with vacation time. So looking forward to meet a new friend, Journey with Jennings. And then in May, we're going to reflect on the 4 seasons of fun in Rhode Island and nearby Rhode Island, right? Nearby Massachusetts and Connecticut, but mostly Rhode Island. We will highlight 4 participants who will share their favorite travel dreams, to share their activities that they've experienced across the state. You remember last year we shared a link with your community guide to help folks with social and recreational activities. This is an extension of that. We'll be adding a section to Link with Your Community that will feature seasonal events and activities that you can do with your friends, families, workers, whomever, and we'll highlight the 4 different seasons and what you can do in Rhode Island during those seasons. So that'll be in May, and then in June we're going to round out the celebration and events with celebrating our direct support professionals. You have a DSP that you want to recognize that you've been working with in self-direction. We want to hear about it. So on Thursday, June 11th, from 6 to 7:30 p.m. in person, likely we're looking at 300 Jefferson Boulevard, our Ripon office. We will have a celebration for our DSPs that we want to recognize, and snack, and have some refreshments. All of the links and the QR code on this slide can bring you to registering for any and all of these events and trainings. Did you miss something? Sometimes you miss, a presentation or a training from last year or the year before. Guess what? They're all online. You can access them on the Ripon website. We have our self-directed webinar library. Here's a QR code. We also have the link on this slide as well. I can see a picture with a few friends' faces on it. So check it out. Many of the presentations are an hour long or a little bit less. None go over an hour. And sometimes you just you may have heard some information, but you forgot it and you want to go back and double check the information. You can do that. So go back and check out the great on-demand webinars that we have available. Any questions for me?
I don't have a question. I have a comment that we forgot to say at the beginning that we keep mentioning about there's a QR code. Whoop, oh, it's gone. So all of this stuff, all of the presentation and all of the links will be on the Advocates in Action website, which will I believe we send out a message, right, Michelle, when it's all up there, the recording and stuff, and the division will have it on their website too, so you can find all of this. And we add other research too, so if anybody else mentions anything else, pretty much anything you want to find, you can find it after the recording.
Thanks, Deb.
Yeah. That's it. I have another question. How much does it cost to go to the conference?
Thanks to the generosity of our supporters from the Behavioral Healthcare, Developmental Disabilities and Hospitals and viewers like you, it is free for our consumers and our DSPs and our families. We do an early registration for our consumers and our DSPs first, and then we open it up to our professionals because our professionals are some of our best ambassadors. Thanks for asking.
And that's the same thing for this too. I would need to talk to my team about that.
That's great, Anna. You and the team are more than welcome.
The Division of Developmental Disabilities updates will be provided by me, Heather Mincy. Next slide, please. So first I'll talk about employment. And on this side, you can see a QR code, which will bring you to our employment services on our website. And there is also an image on the slide. And there is someone standing there looking up and pointing to a job offer. And there is an envelope in front of the person as well. So at the division, we continue to meet with job providers and businesses to create new opportunities for people. One example of this is a partnership that we have with Finley's Dog Treats. 16 people have been hired as demo ambassadors. They are working out of Rumford pet stores across the state. They work part-time, they earn a good wage, and they do product demos in short shifts. I believe they are 2-hour shifts. This has been a great partnership with Finley's and with the Rumford pet stores across the state. And it shows how we can work together with different businesses, local and national, to create opportunities for people. The employment add-on budget is also something that I wanted to discuss. We've heard a lot of really great feedback about the employment add-on budget and how it's made a big difference for people. It's helping them to get the supports they need to find a job and keep a job. And it also has allowed for people to not have to give up activities in the community because they don't need to use their community support hours to for their employment supports. Another thing that we wanted to mention was that last June we met one of our consent decree goals, which was to get 175 people jobs. This year, by June 30th of 2026, we're working towards getting 200 people new jobs. So please wish us luck in meeting that outcome. And if you are someone who is interested in working, please definitely reach out to us and let us know. You can let your case manager know, your conflict-free case manager or independent facilitator, or anyone who might be, supporting you. And they can reach out to us if you are not able to, and we can, talk with you about what's available for employment. Conflict-free case management. So in this image on the screen or picture on the slide, there are pieces to a puzzle. There's 4 individuals. 2 people are standing next to the puzzle. 1 person is kneeling in front, and 1 person is standing behind one of the puzzle pieces. So overall, 2,119 people have case management supports. There are certified case management agencies. These are private agencies, and they are currently supporting 907 people in our system. There are BHDDH case managers who are doing conflict-free case management work, and they are currently supporting 591 people. And then we also have independent facilitators, many of whom were plan writers for individuals who are self-directing their services. And we've actually had some additional people come on to be independent facilitators, many of whom are teachers who were supporting youth in transition in our system. And they support a total of 621 individuals. So all that totals up to the 2,119 individuals who overall are being supported. So we know at the division that there are still many people who do not have a case manager yet. And we are working to fix this so that everyone has the benefit of having this support service. Residential supports. So on this slide, there is an image, a picture of 3 people. 1 person is in a wheelchair. There is someone standing in front of them and someone standing behind them. And there also is a picture of a house. There is a QR code on this slide, and that QR code will take you to our webpage and give you information on residential supports. So currently the division is working with providers to have better options of housing available for individuals by improving or replacing the homes we already have. So there's a lot of work that's being done to update some of the homes that people live in, and also discussions about how we provide new and different options through some of these houses as well. And the residential supports in Rhode Island are overseen by the Division of Developmental Disabilities. And these supports are designed to promote independence, choice, and community inclusion. Youth in Transition, highlights for 2025. And on this slide, you'll see a QR code. This QR code will take you to our webpage and give you information about youth transitioning into the adult DD system. There is a picture, an image on the slide. 3 people, 1 person is standing, 2 people are in wheelchairs. So the Youth in Transition team this year has focused on supporting students that are moving from school into adult life. The main focus this year, though, with the Youth in Transition team was around conflict-free case management, as it's been a big part of the work the Youth in Transition team has done with people transitioning and their families, because the division has made a commitment that all youth who are transitioning would be matched with a conflict-free case manager or an independent facilitator. So all the new people coming into our system are matched with someone. So the Youth in Transition team have been supporting students, family members, and parents and school staff during this transition to case management. Their goal is to make sure that the transition from school to adult life is easier and not so scary for people. Community-based supports. On this slide, there's a picture or image of 5 individuals. They all seem to be smiling. They have some thought bubbles above their heads. One is a hand, one is a heart, one is a thumbs up, and I think one might be a mask. I'm not really sure what's in that thought bubble. Thanks. I see Kim nodding, so I must be on the right track. I think it's a mask. And there's also a QR code on this screen, and the QR code will take you to, again, our website and tell you more about community-based support services. So the division is helping people get supports that connect them to others in their community and help them get involved in activities that will improve the quality of their life. Training and communication. On this slide, there's a QR code. It says this QR code will take you to our webpage and give you information on the Leave Behind packet. There is also an image on this slide of people at a training at the Sherlock Center, and you might actually know some of the people in the slide. I see one person that I do know right up front. In 2025, we listened to the community. We had meetings and we got feedback from people. The information that we got, we used to develop trainings for staff. So people are being supported in making decisions, finding jobs, and living more independent lives, because some of the feedback we got was around, wanting to ensure that people do have supports and that staff are trained in ways to help people engage in, being more independent, finding jobs, and making choices for themselves. The DD Guidebook. On this slide, you'll see an image of the front of the DD Guidebook, and it has a person or a stick figure with stars coming off of their hands. And it says, "A Guide to Adult Services from the Rhode Island Division of Developmental Disabilities." It also has our logo in the top left corner. And then there is also a QR code. This QR code will take you to our website, and it will take you to the guidebook on our website. So one of our many great resources for individuals in 2025 is the DD Guidebook. It's an easy-to-read guide that explains all DD services. It helps participants and families understand what supports are available and how to access them. And again, you can find this on our website. I should also say from the previous slide that the Leave Behind packet was also developed with a lot of useful information in it. It's to help the conflict-free case managers provide information, kind of frequently asked questions that people had. We had a work group, and the guidebook came out of that work group. And again, it's all information that people were frequently asking and wanting to know about. So our communications team put that Leave Behind packet together, and it does have a lot of really great information in it for individuals and families. Thank you. Okay, contact us. So there is an image of a phone, and next to that, we have our main number, which is 401-462-3421. We have our Spanish-speaking phone line, which is 401-462-3014. And then we also have the telecommunication device for the deaf, and that line is 401-462-3226. Then there's another image. It's a location marker to let you know where our address is. It's 6 Harrington Road in Cranston, Rhode Island. That's where BHDDH is located, specifically the Division of Developmental Disabilities in that 6 Harrington Road location, the Simpson Hall building. And then there is another image. It is an email icon. And our email, if you have questions, is bhdddh.askdd@bhdddh.ri.gov. Questions?
Christian's hand is up.
Christian?
Yeah. So Heather, regarding to what you said about the job opportunities, if my case manager Courtney gets in touch with me this month, would it be possible, like, if I talked with her and then we, like, maybe me and her can discuss about a meeting about me trying to look for a new job? Because I've just been trying my best, and if you guys can help me, that would be great.
So we can help you. I don't know if you wouldn't be meeting with me, Christian, but you'd be meeting with supported employment providers who could help you. So we can connect you to supported employment providers who can help you with either job development, if that's what you need, or job.
Yeah, because what I'm trying to do is I'm trying to look for a new job ever since I lost my old one.
Okay, well, we want to help you get a new job, so we definitely will connect with you, Christian. And I also have to say, Christian, I love your t-shirt. I made a note of that earlier, and I was going to mention that. I love Gremlins, and I love Gizmo.
Doesn't!
My first dog was named Gizmo because I love
My
Gremlins
cousin,
so much.
my uncle's dog was named Gizmo as well. Rest in peace.
I know. Rest in peace to my Gizmo too. Boy, do I miss him. But I saw that t-shirt. I was like, oh my goodness, Gremlins.
Man.
People can ask about the slides, or if they have questions about certain things. If you have questions about the DD system and DD services, all we ask is that you don't mention anyone's name specifically. Like, don't say Deb gives me really awful services, because I'm right here. So, but just say I get services and I have a problem, and because it's a good place to ask just questions. Because if you have a question, the chances are really good that you're not the only person who has it. We have one, Michelle, from the Advocates Connecting. I mean, I keep saying the wrong thing. Sorry, Dee. That's the name of the group. The Graduate Academy, whatever it's called.
Connection.
It's all a blur.
Yeah. Do you want me to ask the question? Okay. So in our Academy Connections meeting today, some of you on the screen were there. We have a friend who said that she has a new case manager, and she was given 1 week notice for her ISP meeting, which she was very upset about. They gave her a date and a time, but her father and her sister were not able to make it that day. But the case manager had said that they were going away, they were going on vacation. So this person thought that she had to go to this specific date because that was the only option. So she went, but she feels very uncomfortable about it. We talked about it, about how you can ask for a different date. You know, you can say that doesn't work for me. So we did talk about that. But being that she doesn't feel comfortable about how the ISP meeting went because she didn't have, the support of her family with her, is she able to kind of redo that ISP meeting?
That's just what I was going to say. I was going to say that she definitely should reach back out to that person, and say that she would like to have another meeting where her family can be there. And if she's uncomfortable with that, I'm sure she could reach out to the person's supervisor too. I don't know who their case manager is, but I would just say that there's always a supervisor. They could speak with someone else too if they're not comfortable going back to that case manager. But yes, definitely, I would strongly encourage her to do that so that she feels good about her plan, because that's what she's going to be engaging in for the next year, her support services and anything that she wants to do. And I'm sure her family, especially if she really wanted them there, can provide information and some insight into who she is as a person as well, which helps to, just make a more holistic plan that involves all aspects of a person's life, which is really what the case manager should be trying to do with individuals. So.
Okay. All right. I will pass that message on. Thank you.
Yeah.
That's good news. Good.
And just for adding information around that, the other thing was just so people know, like you're supposed to sign your ISP, like it's a legal document, and it's not supposed to really start flying until you approve it, because it's your money in your budget that's paying for your services. It's not like the case manager is in charge of when and where and stuff. That's the whole thing about person centered and you being the person in charge. So don't sign it if you don't agree with it.
That's very good advice, Deb. Yes.
Well, person-centered is also like person-driven, so it has two ways.
That is very true, Anna. The plans should be driven by the individual and what they want. And so it should be, a shared, when the case manager is reaching out to someone, they should be asking them, when are you available? These are times that I have, not just giving somebody, this is the exact time that we're going to meet. It should be a discussion about what works, for both people.
I just have to say that I am truly shocked that people don't have questions about conflict free, because every time we've met all year, people have lots and lots of questions. But you can only do so much, right? Like you're doing it, going as fast as you can.
We're trying. We are trying.
Well, I know I always have some kind of questions, but it's tough for me because I don't get any services or anything here in Rhode Island, so it's tough for me to really express things that comes to my mind.
Well, there may be other things that people share with you, Anna, as you start more and more to do work as a peer support. I'm sure you're here more, more and more. And it's good that you come here so you get this information so that if you are working as a peer support. You know, when somebody doesn't come to these meetings, you can provide them with information that you've heard.
Yes. Like I know how I feel personally actually about it, but I think my main streamline question is as myself as a peer advisor, what can I do to best help and support many people that are in the systems?
Anna, you could encourage them to come to the forum. It's free, it's online, it's, you know.
Yep.
But if they can't, like Heather just said, like the person that
And
Michelle
you
just
can
asked the
go-
question for wasn't able to come, and we still got the question asked, and we're going to give them the answer when we see them next.
This is a very quiet, relaxed,
Group.
peaceful forum.
Sometimes that's a good thing. I'll say that.
Yeah.
I think everybody's in Christmas mode. I don't know.
I just have to say, just to follow up on one thing from the last DD forum, Jeff Christie is here, and some of us went to see him do his comedy routine, and he is just as funny as we thought he would be. Where'd you go, Jeff? You were just on the screen. It's a famous person. Just hi, Jeff. Yay! Do you have any more shows coming up, Jeff?
So first of all, this happened like a few days after I had just taken the self-employment business class. I went to Davenport with a couple of people from Tops. That's a weight loss thing. So they're trying to increase membership, I guess. I guess they lost a couple groups. So they're talking about all the business stuff. And then they're talking about wanting to do Funny for Fun's show in May to see if they can increase membership, among other things.
And you'll be showing,
So,
you'll be presenting at it, performing at it.
Huh?
Will you be performing at it?
I have been asked to perform at it, and
Yeah.
and my networking crew, I let them know too, and it's May 2nd. I don't remember the location yet right now, but I said I would keep everybody posted. So them and you guys.
There's another forum before May 2nd, so hey.
Yes, I know. So
can you put the camera down, like aim it a little bit more so I can see your face for the recording? Listen to my voice. It's like so your head is in the bottom corner. A little bit more the way you're going. That's Jeff. Just so in the recording people can see you instead of your ceiling.
Okay.
Okay.
So yeah, May 2nd, like in the afternoon, which is good because I have a concert that night. So I'll be quite busy that day.
We're gonna have our own Rhode Island celebrity.
Sweet. Besides you, D.
Oh,
Sharon's
what do you got?
Hi, everyone. So my son is new to self-direction. He just got his plan approved like 2 weeks ago. And I'm wondering if you can provide an update on the peer mentor pilots that are going on. I'd really like to connect him with a peer mentor when that becomes available.
So good question, Sharon. The peer mentor pilot is, I will say it's slow going because people are just trying to get grounded in how they are going to support people, how the two agencies who have stepped forward to do this, they are just working with people within their agencies right now. It's looking upward and perspectives. I have asked them about how many people they think they can support. They are low numbers right now because initially, again, they're just trying to implement it and see how it's going to work within their agency. So I think maybe at the next community forum, we may have more information on peer supports and looking at it being offered by more agencies.
So we have perspectives for our FI. Is that something that I should reach out to just to get on a wait list?
Dee knows. Dee's wiggling her hand. She does it there. Go, Dee.
All right, Dee, you can jump in because she probably does have more information about that from perspectives.
So I know that we've just kind of begin conversations about what that would look like. But I do know that coming down the pike, probably sometime in January, we will have um, informational sessions for people to learn more about the peer mentor program.
Awesome. Thank you.
Thanks, Dee. Thank you.
You're welcome.
On the peer support work group, where is that at now?
So we took a break for a little while, Anna, so that we could allow the agencies to start doing some of that work. And then we were going to come back together to discuss how it was going. That's kind of where we're at. So in the new year, we will end up meeting again. So you'll get a meeting invite because you are part of that work group. But it will be after, sometime after the holidays. It either will be end of January or early February.
Thank you. That's something I can bring up to my team. More importantly to my supervisor. So it's good to have that information.
Yeah.
Jessica
Good
has a
question.
question. Jessica has a question.
So I am a certified peer mentor resource specialist. And I just took the class actually just as of late last year. My FI provider, as like Sharon said, I am through Perspectives. So I was wondering when I should be receiving a phone call to get started with the peer mentoring sessions.
I have to jump in because do you mean the one that you did with us, Jessica?
Yeah, so like I've been waiting for the phone call.
Yeah, so you're talking about the training you did with us though, right?
Yes. So like, but I wanted to know what the
right. I'm gonna answer that you're probably not gonna be getting a phone call yet because our training, there wasn't all the information about how to do it yet. Like the training, as we said, because the state was still figuring things out. We talked about what is a peer mentor and what are some of the things and what is it. Then that was for people who self-direct. But there's a piece missing, which is why they're doing the pilots right now to talk about some of the logistics. And so, so you took that course, but I don't think that's going to be all that they need because there's got to be some kind of overall because it's a state, it's a service, and when you have services that Medicaid pays for to be reimbursed, there's got to be like certification. Is that the right word, Heather?
Yes,
certification standards. So there's got to be a little bit more to it. And once we know what those are, and once we talk to people, like we're going to be meeting with Heather sometime to just talk about like once we know what all the other pieces are, then we might talk to people who went through our training with an extra like here's another piece of the course so that then you can do it because it's still it's missing a part in the middle just because it wasn't ready yet.
Oh, all right. So do I now
just stay
like,
tuned.
So now, like with that being said, do I have to take the additional?
If that's the way it happens, if that's the way it goes with the being a peer mentor for people that self-direct, if that's one thing that the state's like, yeah, let's do that too because right now they're just trying things out because you never know, you have to try things out. So once they do that, what we might say is that people who went through that training with us, because we had like, I don't know, like 30 or 40, when those people, when we have that, when everything happens, when we have more information, we might make a little mini course that says, here's the pieces that are missing, like things like what are helping people understand what are the regulations, what are the licensing standards, because if you're going to be providing a Medicaid service, you're going to know some of those nitty gritty boring things, which the state is still trying to figure out how to put together. But they're working on it, and then once we know and they know, then we'll be in touch with the people that went through that training.
Okay, so now do I wait on this? Like, do we come back in the next?
Yeah, you have to wait because I don't even know. That's just what I'm saying is like this is one possibility. Like I'm not sure how it's going to go down, and nobody is. Like Heather's the one who would know the most, and she doesn't know yet, right, Heather? So once we have more information, one way or the other, when we have more information, everyone who took the class with us, we will be in touch and say either here's something else you can do, here's something we're going to give you, or here's some other places. Whatever it ends up being, we will be in touch with everyone who went through the course with us. So so just hang on. Yeah.
Okay, so
Yeah.
so just wait like in the next like
Yeah.
month or two or whatever it is.
I can't
Whatever
give you
the
a
next
timeline
forum.
on it. I'm sorry. I don't know. It's
No,
just, all good
I
things take time. I know.
that's
Yeah.
fine. I was just
Yeah.
curious. I didn't
Yeah,
know
no,
what the
I
status
understand. I know you've
was.
been asking for a while. Yeah. Yeah.
Yeah,
I
so
will say though, I'm glad you are asking, Jessica, because as we do move forward with peer supports, we are
yeah.
going to need people who do want to do this work.
Yeah.
So I'm glad that you are
And
asking
she'd be
because
really good at it too, Jessica,
yes,
Heather, just so you know. It's just we're missing a piece. So when we get more,
and and there may be people, as agencies start thinking about doing this work too, there will be people looking for people who are willing and have some training. But
Yep.
as Deb said, there probably will be additional trainings you will need to go through in order to be a peer support because it is a job, it is a service that you're providing. And
Yep.
there are just some basic things that you need to know about when you're providing a service that's being paid for by Medicaid.
Yep. So now, does Perspectives call me with all this information, or do I, like I said, do I just find out the next quarter?
So it will be the next quarter. The agencies who are doing peer supports now are using
Yep.
people that they already have within their agency. So they've already identified who they're using. So
Oh,
as
okay.
more agencies or other opportunities come up for peer supports,
Yep.
we will talk about that and what that looks like. But as Deb said, no one will be reaching out to you right now other than
Oh,
Advocates in Action as they get more information and can let the people know who went through
okay.
their training course what
Yep.
else they need to do and how they can connect them with potential job opportunities. But it will be sometime in the future. Honestly, it probably will be closer to like summertime that we're talking
Okay.
about some of that.
Yeah. Okay. I just
and
wasn't.
just,
I just wanted to like
yeah.
make sure that this was all relevant and like fresh in my head because I am with Perspectives. So as an FI provider, so I'm surprised that like they didn't reach out to me just yet and being like, oh
Well,
hey,
so Jessica, the training you did did stuff about self-directing, but the agencies, I think they're doing it first with people that get services through the agency as a first step because there's more people there that do that. So just hang on. I know you're anxious to do it and you'll be really good at it, but it's just not ready yet. So Claire has her hand up too before I don't know, 411.
Oh,
Hi, Claire.
hi. I don't know. I think people have gotten a lot of answers on this, but just a question for the people who self-direct. We got an email last week about a training that DSPs need to do before the end of the year, which is a little unnerving because it's a tight time frame. I know that training is pretty simple and people are beginning to access it and it's maybe not as scary as it seemed at first, but I don't know if Jackie or Heather, if you want to just kind of respond to that. And what if people didn't get the email or they didn't hear about this or they miss it, or what happens if they don't follow through by the end of the year?
So yes, I was very surprised nobody asked about that, Claire. So we did email everyone, and we are working on doing a mass mailing too. So getting it out, in the actual snail mail to people as well. We had our first Zoom meeting yesterday. It was from 4 to, well, it was supposed to be from 4 to 5. It went from about 4 to, I think, 6:15 or something like that. So, yes, but it was really great. We had 140 people who attended that, and we were able to go through, the very basic steps of what, or basic information about why people need to do this, that it is a mandate and it needs to be done. The federal government is saying people need to have this training, all DSPs. And we walked people through the train system, which is where the training is housed, and how you get into that system, creating login information, and then just the different things that you need to do to get set up in that system in order to take the training. So we did that yesterday, and I think there were many people on that training who were actually able to do it during that webinar. There were many people who did it then We're also having another webinar on Thursday. We did the one last night in English and Spanish too. Elvis was there with me, and we were both going through the slides with Jackie and Sheila Coyne, navigating questions in the chat. So I think that one went really well. We got really good feedback. We'll have another one on Thursday, and people do have information to reach out to their support brokers, their independent facilitators, or conflict-free case managers. Jackie's done a lot of outreach to people, letting them know about this and who they can connect with if they need additional support. The Self-Direct Coalition is the organization who we really have told people if they need support, they can reach out to them. I know they're getting a lot of phone calls and emails, so I also would say for people to be a little bit patient as people are able to get back to them, but people will get back to them. To your question about what happens if people don't do the training. So we know it's a tight timeline. We're really trying to push to give a really good faith effort to get as many people through this as possible by the end of the year, because that's what we've been tasked with doing. If people do not go through the training, so we have asked that people send back the attestation form. So each individual who self-directs their program needs to send back to the Ask DD website the attestation form. The employer, the person who's self-directing their services, needs to sign off that all of their staff have completed that training. Once we get those attestation forms into that Ask DD website, we are putting them in a folder, and where we have a list of all people who are self-directing, and we will check that person's name off. After the new year, we will start to go through that list and see who has not responded, who has not sent in their attestation form, and start doing some outreach to those individuals to let them know, this is mandatory. They need to do that. Once we follow up with people, we will be sending letters out to let people know that if their staff are not completing these, they will not be able to work for the individual. It is mandatory. It has to be done.
Heather, I have a question for you. So
Yes.
this is Deanne, by the way. So is it that it's just the employer that has to sign, right? Or
It's
is
just
it
the employer. Yes.
it's not
The
it's not the
employee.
employee at all. Okay.
No. Nope. The attestation form is just for the employer. So it's for the person who's self-directing their services to say that all of their staff have taken the training. We did not ask for employees to sign off and send in those forms because we at the state will have no idea who people's staff are.
Yeah.
So we'll never know if everybody's staff person actually went through the training. That's why we're asking the individuals to sign off that all their staff have taken it. I do want to say, oops, go ahead.
Go ahead, Heather.
I was just going to say also, because we did have, I want to say at least one person sign off on it right away and send it back. And we outreach to that person. And we also made this clear yesterday during the webinar that, we are really relying on people being truthful when they send in those attestation forms. And at any point in time, a person who's self-directing their services could be asked if they sent in that attestation form for the names of their staff people, and whether it's DD or the Executive Office of Health and Human Services, so EOHHS, could ask as well for the names of staff. And when people take that training, they get a certificate and their name goes into that system.
Yeah.
So that is our way of tracking that people actually did it. So if your staff did not do it, you should not be signing off on that form. I just want to caution people on that as well too.
So you just answered my question, my second question, which is the certificate, because I know that I've had many questions over the last couple of days, and I know that I require people to actually show me that certificate so I can put it in their file.
Okay,
So
that's good.
I want to make sure I was doing the right thing.
Yes, that is a good thing to do. And if people can't actually, I know sometimes people don't have access to a printer. And so if somebody does it on their phone or somebody does it on their computer but does not have a printer, you could even take a picture of it, take a screenshot just so that you can let your employer know that, you've taken it. And so you as the employer can also see, have proof that that person did take that training. And I would ask staff for that proof because again, if somebody ever asked, I'm not saying that people are going to do that, but they always could. And you want to make sure that the information that you're giving to the state is accurate.
Well, and that's why I have them send it to me, and I just print it out for them.
Yeah.
So, thank
So
you.
Heather, I'm hearing that some people are having trouble. They go through the training, they get to the end of the slides and can't access a certificate. It's apparently a glitch in the system.
I've heard that as well. Yeah.
Okay. I didn't hear that last night. I haven't heard that. Jackie, have you heard that?
Hi, Heather. Sorry.
That's okay.
I have heard that. I don't know if there is a way if you can log out and then log back in and then see their certificate. There's many times where there's glitches, so there's certain points of the registration and trying to log in where it doesn't let you go further. I actually completed the whole process today, so I am available also to help answer some questions if I can. I know Sheila, like Heather had mentioned, she has many calls coming in. So if I can assist in any way with the certificate, please reach out and let me know.
Jackie.
And to Jackie's point,
I was just gonna ask Jackie. So, if people have trouble getting a certificate, then do they? And let's say they have to clock out. Will that certificate still be there, or will they have to do the whole thing again?
It should still be there, Deanne. If they log back in, I believe it would be under their profile. If you go up to the top, oh, I see Kim shaking her head. Maybe.
Yes,
if you go up
Crystal
to the
just
profile.
says, Crystal, do you want you want to say that, or you want Andrew to read it? Crystal, are you there with the baby? Let's see the baby, Crystal.
I'm not home, sorry.
Oh, all right. Can you explain what you just said?
So if you go back to the home screen, there's a tab that says Your Learning. And if you click that, you're able to get your certificate that way. I've shared it with the listserv and our self-directed network. I did screenshots of myself doing it, like the different tab that you click and what you have to click after to get it. But it should be under there. Even if you log out and log back in, it should be under Your Learning.
Okay. I just wanted to double, in case I get that question again, that's like, I wasn't able to get my certificate. So.
Yes, people should be able to log out and then go back into the system. And I do know that there have been glitches with the system. We also, people with trying to move on once they're in the training, reminding people that they need to save their information every time they're in that training and going to a new page, or even when they're registering, doing their login information, make sure that people are saving the information, because I think that was also a big thing that we heard yesterday. So, Kim?
Yeah, if it's helpful, I can share my screen and show you what it looks like to retrieve that certificate, but I don't want to disrupt this conversation. So, happy to not share what it looks like. I don't know if anybody wants to see it, or.
Does anybody feel like it would be helpful to see it? I don't know if anybody here actually needs to take this training.
It might be good to see it in case, because it's in the recording, for the sake of the recording.
Yes, that's
you
true.
can just do
Yes,
it quick,
that is
just
true,
quickie,
Kim.
Kim, just because some people mentioned it. So
Sure, real quick.
Yeah, because I was about to say, I don't mind seeing it.
Okay. Well, hopefully you can see my screen okay.
Yes.
Definitely can.
And you'll see right in the middle there, it says 1 certificate obtained. And so there it is. So it's under the Your Learning, just like Crystal mentioned, once you log into your account.
And Kim, when people, they get to that because they'll get that message from the division that with all those letters saying you need to go do this training. So that's how they can get to that site. And is that how? Like you don't just go to train.org and.
Well, I'll let Heather answer that question because I didn't receive the communication from last week. And that was actually one of my questions is who pushed out that communication? And is it everyone who uses self-directed supports that received that?
Yes, it is. Everyone who uses self-directed supports who had an email address on file with their fiscal intermediary. That's who we sent it out to initially. Right now, we're also, like I said, looking to send it out through our mail, but that just takes a little bit longer. But we're working on that, especially because it's so many pages. It's a little bit, they can't put them in the regular envelopes. It has to go into a different envelope. So again, just taking a little bit longer.
When you know that I had took that training.
So Heather sent us a copy or Jackie sent us a copy. And the answer to my own question is yes. When you get the email, there's one that just says about the training or HCBS because it's home and community-based services, which like people should know about because those are the rules. If you're in the leadership class, there's 10 requirements about your services. And it's a big deal because if your services aren't meeting those 10 requirements, you're missing out on some good stuff. So when you do it, I'm just going to show you that it does. It opens this screen, and the first time you have to go there and log in, but don't just go to that site because you're gonna get a message and it's linked to where you need to be. So if you didn't get that training, if you didn't get that email and you self-direct, now you could email the division, Heather. That you could email Jackie if you need to get that information and you didn't get it.
Yes.
And should we put that information on the recording page too?
Yeah.
Those letters so people can find it there?
Yes, that would be good,
Okay.
Jackie.
All right.
Yeah. Oh, well, you already have it. I was just going to ask Jackie to send it.
You sent
to
it
you,
right
but
away.
did
Now we
already
have it to
sent
share.
to you.
Yeah.
Yes. So if you could, that would be great. Very helpful.
Thank you very much, Heather, and everybody for all the information.
So it's 4:26. Does anybody else have any questions or comments or cool news to share? We'll let you know when Jeff is going to do his next show. You don't want to miss it, really. It's the first one. You missed out.
Well, I just want to let you know that Christmas is in 9 days, everybody.
How many minutes, Jeff? How many minutes? I mean, Michael. Michael is the best timekeeper. If I didn't say it was 4:26, he would say, "Oh, it's 4:27 now." That was a compliment, Michael. You're a good timekeeper. Way better than me.
Yeah, I know. Well, I just made this picture showing you all that I want to wish you all a very Merry Christmas.
Oh, thank you. Wish you a Merry Christmas
Thank you,
too.
Michael.
Is it sharing up there on the screen?
No.
Do it again, Mike. It's not showing. You're not
sharing.
showing the right screen, I think.
Oh yeah, yeah. Let me
Try
fix
it
that.
again.
Let me fix that. It's just
It's time with more feeling.
Right.
We got it.
All right. Hold on. Trying to get that. How does it look?
I don't think it's
Can't
showing.
see anything yet. We can still see you. Oh, maybe it's coming.
Nope, you're gonna want to, Michael. You're gonna want to look for a picture of the image on your share screen and click that one because you're sharing a different screen than the one you want to share.
I don't even see it on my screen. It's just dark.
Yeah, no,
on my
he's
screen.
just a confusion. A lot of people have that.
Oh,
Get
okay.
confused about that. Just stop that one, Michael, and find it. Look at your when it shows you the things.
Oh,
Yay!
oh, oh, we have
Thank
it
you.
already.
Roll.
I gotta go.
Once more, Jim. Once more, Michael.
That was cool,
Like the
Michael.
pop-up.
Yeah, it was.
Yeah.
If you think his pictures are cool, you should see his animations. He does really
It's
cool
so
animations.
Oh, that's awesome.
I got those on YouTube.
I like your
Oh.
cartoons with the crows.
Yeah.
That was a good way to
Thank
end the
you.
meeting, huh?
Yeah, that was. I feel good about that.
I'm gonna grab it out of the
Kim,
out
I
of the
like your
screenshot and put it up there
Christmas
longer. Only for a second.
Deb or Michelle, I do have a quick question on the leadership class. Can I do the informational, like the second open house first, and then do the application,
Yeah,
or do I?
Yeah,
or
that's
do I
the
have to do
idea.
application
Yeah.
before?
Yeah.
Yeah.
Okay.
yeah, definitely join the open house, get all the information, and then if you want to apply, you can fill out the application then.
Okay.
Yeah.
I just didn't know like if there was a certain way to do it or
Nope,
you know,
that's what
or
the
whatever.
information sessions are for. Yeah, that's
So you
great.
don't have, just so people know, you don't have to come to the open house.
Nope.
You can just
Oh,
you can go
okay.
apply right now. People, we already have a bunch of applications, and space is limited. So
All right. Okay.
Yeah.
Thank you.
All right. Well, if that's
well,
it, then
Yeah,
I don't know,
thank you
Heather.
so
I feel
much.
like you don't want to pull the plug on it, but we'll.
Yeah,
I'll help
yes.
you.
Well, if there were any more questions, but thank you so much. It was a great discussion. People were a little bit quiet, but we got a lot of, stuff covered and hopefully provided you with some information that was useful. So thank you.
thank you to our interpreter. Thank you, Joy, for being here and helping
Yeah,
people.
thank you, Joy.
Everybody for coming. Happy
Yeah,
holidays.
Happy
you.
holidays.
Bye, everybody.
Happy
La,
holidays.
la, la, la,
Merry
la,
Christmas.
la.
Yeah.
Better go. We're gonna keep singing. You'll be sorry. Ah!
As
Bye,
well.
everyone.
Contact the Division of Developmental Disabilities. Phone 401-462-3421. Para dejar un mensaje en español, 401-462-3014. Email bhddh.askdd@bhddh.ri.gov. You can watch this recording again and find out more about the topics that were discussed at www.advocatesinaction.org/DD Community Forums. Produced by Advocates in Action RI for the Rhode Island Division of Developmental Disabilities, BHDDH. Remember, nothing about us without us.